Welcome to your calmest deep clean session of the week. Today, giant pimple decompression plus precision blackhead removal. Every pop, click, and release in crystal clear ASMR. No nails, no force, just safe, dermatologist-inspired technique and real results. Apply a fragrance-free gel cleanser, massage 60s in slow circles, rinse lukewarm, pat, not rub, dry, ASMR cues, soft lather, water trickle, towel pat. Steam 60-90s or warm towel to soften plugs. Smooth on a thin slip layer, glycerin HA essence, so tools glide without scraping. ASMR cues, steam hiss, towel rustle, serum drip. Now we approach the most delicate phase, safe decompression. Before we proceed, we must ensure the lesion is truly ready. We consult our readiness checklist. First, is there a visible, well-defined head? Yes, the contents are near the surface, not buried deep within the skin. Second, is there any deep throbbing pain? No, the intense inflammatory stage has passed. A throbbing sensation is a clear signal to wait. And third, is the lesion rock hard to the touch? No, it has a degree of softness, indicating the contents are fluid and not a hardened, deep nodule. With all three conditions met, we can proceed with confidence and care. This careful assessment is the most critical step in preventing scarring and further inflammation. Patience is not just a virtue here, it is a requirement for healthy skin. With our gloved hands, we take 2 sterile cotton swabs. We place them on opposite sides of the blemish, on clean, healthy skin. Now we gently stretch the skin apart. This technique, known as cross-stretching, is fundamental. It serves 2 purposes. It anchors the surrounding tissue to prevent tearing or bruising, and it creates a taut, clear pathway, encouraging the contents to exit directly upwards rather than spreading underneath the skin. The pressure is outward, not downward. We are creating an invitation for the blockage to release. For a lesion with a particularly stubborn surface, a trained professional may perform this optional step. Using a single-use sterile lancet, we make a tiny, incredibly superficial nick. This is not a puncture. The motion is weightless, precise, and parallel to the skin, creating a minuscule gateway right at the apex of the pustule. This ensures the epidermis doesn't tear under pressure, allowing for a much gentler and cleaner release. This step requires immense precision and should never be attempted without proper training. Now, for the decompression itself. Using either a rounded Comdone extractor or your cotton swabs, we apply pressure with a specific rolling motion. Place the tool on the healthy skin next to the lesion. Press gently down, then roll inwards and arc upwards. Imagine you are scooping the contents out from underneath. This down and out arc is the key. You must never, ever press straight down. Pushing directly down can rupture the follicle wall beneath the surface, spreading the impaction and creating a far worse inflammatory response. We catch the expressed contents on a piece of sterile gauze. Once you see blood or clear serum, you must stop immediately. This is the signal that the follicle is clear. Any further pressure will only cause trauma. The body knows how to heal the rest. Now, we begin the most satisfying part of our deep clean, the extraction sequence. To minimize redness and prevent overwhelming the skin, we follow a specific path, moving methodically from one zone to the next. We'll start on the bridge of the nose, an area that's typically less sensitive, before moving to the sides of the nose. From there we'll address the tip, then the delicate area of the philtrum above the lip, followed by the chin, and finally, the inner cheeks. This systematic approach ensures each area is treated with focused, gentle care, allowing the skin to remain calm throughout the process. Our tool is a sterilized Comdone extractor, a professional instrument designed for precision. The technique is everything. The key is to avoid causing trauma to the skin. We're not digging or forcing anything. Instead, we place the loop of the extractor at a 30 to 45 degree angle against the skin, right beside the pore. With very gentle, steady pressure, we roll the tool across the opening of the pore. Imagine it as a soft, scooping motion. You're not pushing down. You're gliding forward, and the edge of the loop coaxes the softened impaction out. If a blackhead doesn't release with this gentle pass, we leave it. Forcing it will only lead to inflammation, broken capillaries, or even scarring. Patience is paramount. Listen closely. That soft, satisfying little pop is the sound of a successful extraction. After each small section, we immediately soothe the area. We take a fresh cotton pad soaked in sterile, alcohol-free saline solution. The saline is isotonic, perfectly matching your skin's natural balance, so it cleanses without any stinging or irritation. We gently swipe over the treated pores, wiping away any debris and instantly calming the skin. This step is crucial for hygiene and preventing post-extraction breakouts. The gentle glide of the tool, the quiet pop of release, and the soft swipe of the cotton pad, it's a symphony of clean. We continue this delicate dance of extraction and soothing zone by zone until the canvas is clear and calm. Mist with thermal water or saline. Apply cooling gel, aloe/centella/panthenol. Optional, cool spoon roller 3060s to reduce redness. ASMR cues, brush strokes, cool glide, pat finish. Papulas, pustules, pea-sized benzoyl peroxide 2.5%, spot only. Comedones, blackheads, salicylic acid, 1-2% gel, T-zone. Overnight rescue, hydrocolloid patch on any weeping whitehead area. Seal with a light, non-comedogenic gel cream, ceramides plus humectants. No fragrance, no essential oils post-extraction. After extractions, your skin is exceptionally vulnerable. The most critical step to protect this healing tissue is applying a broad-spectrum sunscreen with at least SPF 30 every morning. Sun exposure on delicate skin can trigger post-inflammatory hyperpigmentation, creating dark spots that outlast the blemish. Choose a non-comedogenic formula to avoid clogging your freshly cleared pores. A mineral-based sunscreen can be especially soothing, making this step essential for preserving your hard work. To maintain clarity, gentle exfoliation is key. 2 to 3 times a week, but never on the same night as extractions, use a chemical exfoliant. A BHA product with salicylic acid is fantastic, as it's oil-soluble and cleans deep inside the pore lining to prevent future clogs. Alternatively, a fruit enzyme mask offers a milder approach, gently dissolving dead cells on the skin's surface. This consistent upkeep is the secret to long-term smoothness. Your environment also plays a huge role. Simple habits can prevent new breakouts. Change your pillowcase every few nights to avoid sleeping on a buildup of oil and bacteria. In the shower, always wash your face, rinsing your hair to remove any pore-clogging residue from conditioners. And don't forget your phone. Wipe it down daily to remove bacteria that can transfer to your cheek and jawline during calls. Finally, know when to seek professional care. At-home extractions are only for surface-level, non-inflamed blackheads. If you have deep, painful lesions like nodules or cysts, do not touch them. Attempting to extract these can lead to severe infection and permanent scarring. Other warning signs include spreading redness, heat, or persistent bleeding. If you see any of these, consult a dermatologist or licensed esthetician for safe, effective treatment.